Is having ice cream a painful experience? Does brushing or flossing bothers you? In that case, you may have sensitive teeth, which is one of the most common dental problem. Hello everyone. Today we are going to discuss about the causes of dentin hypersensitivity and its treatment. What is dentin hypersensitivity? Dentin hypersensitivity is characterized by short, sharp pain arising from exposed dentin as a response to stimuli, typically thermal, evaporative, tactile, osmotic, or chemical, which cannot be ascribed to any other form of dental defect or pathology. Tooth sensitivity affects 1 in 7 people, especially women. In healthy teeth, there is a layer that protects the crown called enamel. In the same way, under the gums, there is another layer that protects the root of the tooth, which is cementum. Dentine is present beneath the enamel and cementum. It contains dentinal tubules. When these dentine loses protective covering of the enamel or cementum, or when the gum recedes, sensitivity is felt. Other conditions exist where dentine is exposed, causing sensitivity identical to the dentine hypersensitivity are fractured teeth, caries, marginal leakage of restoration, cracked cusp of the tooth. Causes can be studied under two topic lesion localization and lesion initiation. Lesion localization includes the enamel loss, gingival loss. Enamel loss can be due to erosion, abrasion, attrition, or abstraction. Now, the lesion initiation, it requires the opening of dentinal tubules. Toothpaste remove the smeared layer through the abrasive and detergent action. Erosive agent, particularly acid dietary fluid, readily exposes the tubule. Most of the soft drink, alcoholic beverages, and yogurt. It removes the dentin smear layer after a few minutes of exposure. Erosion causes bulk loss of dentin and surface softening, which is very susceptible to physical insult. Mechanism of action can be studied under four theories: neural theory, gate control theory, odontoblastic transduction theory, and hydrodynamic theory. Now comes the treatment part. Treatment can be studied in a flowchart pattern. It initiates with educating the patient about the risk factor, advising the patient to remove the excessive acid from their diet, then brushing teeth before eating and demonstrating less aggressive brushing technique. Then follow up is needed. Does the hypersensitivity continues? If no, then no further treatment is required. If yes, then choose desensitizing strategies like considering both cost effectiveness and convenience. There are two methods: non-invasive and invasive. In non-invasive method, there is desensitizing toothpaste, topical agents which are done in office treatment. Then invasive contain mucogingival surgery, restoration, pulpal treatment. Follow up is required. Does the patient's hypersensitivity continue? Was there any improvement? If so, does the patient want further treatment? If no, maintain the current treatment, review regularly, consider for predisposing factor. If yes, then review diagnosis to exclude periodontal pain, neuropathic pain, referred pain, chronic pain syndrome. Should dentinal hypersensitivity treatment and the patient education continue? If no, then refer the patient to appropriate specialist, both dental or medical. If yes, then continue the dentine hypersensitivity treatment and patient education with reminders to alter the predisposing factor.